This episode is brought to you by Club Pilates of Westfield, located on East Broad Street in downtown Westfield. Club Pilates is a boutique Pilates studio specializing in low-impact, full-body, reformer-based workouts. Club Pilates offers a variety of classes that challenge your mind as well as your body. Contact Club Pilates Westfield to reserve your free intro class today.
You start, like, when you've done this, how long did it take until you got comfortable with this setting?
Like recording it? The first few were rough. Definitely when we did with Tim and Aaron from CrossFit, and they just opened a Scotch Plains indoor fitness. And, it was like such a debacle. Now I can like turn it all on in 5 minutes and I'm ready to rock.
Yeah.
But yeah, because it was a skill set I had to learn. I ran a restaurant for 6-7 years.
It's totally different.
Yeah, I watched like 1,000 YouTube videos.
And you're in like a space where someone else is here talking to you. My friend does a podcast, and his is all like Zoom based.
Right.
So he talks to like athletes and musicians and performers, but they're talking like not next to each other.
Right.
So he's just pressing his Zoom camera on his computer, and then boom.
And that's it. But yeah, eventually. With anything, right? How many times like have you taken someone's eye pressure? And in the beginning you're like, okay, look down, then look up. Right?
For sure.
Well, we're jumping right into it. We got Dr. Savitz here from, is it North Jersey?
Eye Center of North Jersey.
Center of North Jersey. My bad, guys. My bad. We met online, I believe, right, initially. And once I heard you were an eye doctor, I was like, you know what? We haven't had an eye doctor on the show. It's something that's near and dear to my heart. So we have to have Jan and have you tell your story. So Dr. Savitz, tell everybody a little bit about your business, where you're located, and then we're going to get into the meat of stuff.
Sure. Yeah. So our office is located downtown Scotch Plains. If you know where the Stagehouse Tavern is, then you know where our office is.
Right.
The office has actually been in the community since 1984. It was originally owned by twin brothers, Dr. Mark and Dr. Paul Levinson. So they've been practicing in Scotch Plains for a long time. I bought the practice from them in February of last year.
23. Okay, cool.
And we've been up and running since then.
Wow. Yeah, and things are going well, I hear. I've only heard good things. You have lots of great Google reviews and whatnot.
Always glad to hear that.
I got to research people, before you come on the show. I got to make sure you're not crazy, No, but seriously, eye care is something that's so important. I think we were talking about this before we started recording was, it's something I think people take for granted when you don't have any eye issues throughout your life. So maybe you go 3, 4, 5 years without getting a checkup, or, you just kind of don't think about it if you don't have to. But it's so important to make sure that your eye health, your children's eye health is on point, because it's one of those things. It's like sometimes things can go wrong and you don't even realize it, right? And it's kind of far down the road before you kind of catch it, and that's not what we want to happen, right?
Absolutely. You just hit on pretty much every important point. You took the words out of my mouth. But yes, people definitely take vision for granted. It's something that you don't really think about. You kind of just go about your day and you live and you see, and it's not until people have major problems with their vision that they really start to realize how important getting their eyes checked regularly is.
Right. So people just think I guess probably too, it can decline so slowly. So like it gets a little blurrier. And then next thing you know, you're like, oh, maybe I need glasses. And that's like probably very common. But there's also people like me, for example, I've had glaucoma for 30 years since I was 8 years old. And so glaucoma is something that sneaks up on people, and you don't have to necessarily be old for it to happen to you, right? We
call it the silent thief of vision. And you know all about that. We talked off camera about your case, and it's you have utmost respect for the field of optometry, and
sure do. It's because it's not. I mean, it's not even just eyes too. Like your wife was telling me a story about how like you found something wrong with someone's brain through their eye exam. Can you tell me a little bit about like experiences like that?
Yeah, absolutely. So as part of our exam, we have imaging we do. Which shows us the back of the eye called the retina. And in the retina, you have your optic nerve, which connects the eye to the brain. And, oftentimes things can have no symptoms at all. And we might be the first people to look in the back of the eyes, maybe in this person's entire life.
Wow, yeah.
And when we look back there, the optic nerve has a distinct appearance to it. And we can tell right away if there's, something wrong with the nerve. We can see swelling, changes to the coloration of the nerve, and those can be indications that there could be something going on in the body or in the brain.
Wow.
We can be sometimes, detecting brain tumors.
From the optic nerve?
Looking at the optic nerve. The optic nerve can have a swollen appearance if there's a tumor in the brain.
Really?
We can see changes to people's blood vessels. So if you have diabetes, especially diabetes, blood pressure, high cholesterol, and these are all things that most normal people, normal Americans have.
Right.
And we might be the first doctors that can detect that.
So let's talk about that, because that's super common, high blood pressure, diabetes. If someone is maybe, say, pre-diabetic, right? And I think we all have seen the commercials. We know, like, oh, you can lose your vision. But I think it's one of those things you don't really understand until it happens to you, right? So it's like putting the emphasis on prevention. So if someone has those things, like, how often should they be getting their vision checked?
If you have diabetes, the standard of care is to have your eyes checked every year.
Only once a year?
Every year.
That's
and
it?
If you have bleeding in the back of your eyes, if you have what we call diabetic retinopathy, then you have to be checked more often. And some people...
I would go more.
Some people have to get checked, every month, every 3 months, depending on their case. If they're getting active treatment done for their retina, if they're seeing a retina specialist, they're going to be treated regularly and every month or so.
Right. And is there anything that people can do on their own? Like, I take something called MacuGuard. I don't have macular degeneration, but just because I have the eyes of an 80-year-old woman, I take it anyway, just as preventative. And I actually notice it does make my vision a little bit more clear. Or just other supplements you recommend that people take to just be healthier and have better vision.
Yeah, I mean, using an omega-3 is vital to our health and our eye health. Lutein and zeaxanthin are two supplements that can be very beneficial in protecting your macula, which is the back of the eyes. At home, if you have light eyes or if you have a family history of macular degeneration, taking a lutein and zeaxanthin supplement is probably a good idea. It can't hurt you.
And that's stuff that's in salmon, right? That they say is good for eyes. That's why it's pinkish. The MacuGuard is pink. I think it's a zeaxanthin. So diabetes, high blood pressure. So when we were kids, right, we all get our eyes checked at the school nurse, right? And that's kind of I think the first indicator of whether or not you need to go.
Exactly.
Right? Is that still the status quo, or has that changed?
So we start seeing kids in our office as early as pre-kindergarten. I think that's the standard of care. Before you go to kindergarten, you should have your eyes checked.
Very good.
Some people will get the vision screening at their pediatrician's office, and those can be done, I think as early as maybe 6 months.
Right.
And that will kind of detect if there's something that needs to be more closely evaluated. Right. But if you have someone at home that's entering kindergarten and haven't had their eyes checked yet, it would be a really good idea to start, thinking about doing that this summer. What
are some signs that a parent might need to bring their kids in besides maybe some squinting, kind of stuff? Is there anything else that would be a warning sign?
So, squinting, holding things far away if someone's trying to read something and they have to pull it further away. But these things are subtle, and a lot of kids actually have really good distance vision, but they have problems up close.
Interesting.
They may have what we call a convergence insufficiency.
Okay.
So when we read, our eyes have to converge together. They have to move as we read through that text. And a lot of children have a problem with convergence. We also do what we call accommodate. So when we're looking up close, there's a lens inside of our eyes that changes its shape and configuration.
That's cool.
And a lot of children also have accommodative insufficiency.
Okay.
So they either can't follow the text or they can't focus on it very well.
Right.
And these things are not always obvious or apparent. So when we do testing in our office, we can check for those things, check their convergence, check their accommodation status. Even if they're 20/20 for far away, if they have a reading vision issue, that may help, if we find that early on, it can help them with their learning and their school down the road.
Right. So you're telling me about something else that you guys are doing now that helps to prevent the changing in prescriptions being super, I guess, more often.
Yeah.
You said it in a much more eloquent way, but can you explain that to me a little bit?
Sure. So when we have a hard time seeing far away, the general term for that is called myopia. Okay. And what we've been doing in our field for the last 5 or 6 years, I'd say, is something called myopia control. So we're trying to get ahead of the situation now. Instead of just prescribing something and saying, here, this is your prescription, let's see if it gets worse next time. We're now trying to control the progression of that condition.
Right.
And so if parents have a high prescription, so if you have anything over a -4, there's a good chance that you're going to pass on those genes to your kids as well.
Really?
And they might wind up with bad vision as well. So if we start doing routine exams from an early age and we see that the prescription is progressing at a quick rate,
Interesting.
then we can start myopia control. And some of the studies have shown more than a 50% reduction in the endpoint of your prescription compared to individuals who haven't done that myopia control
That's really
over
cool.
the same period of time.
And so how was that done exactly?
So in our office, we'd use a soft contact lens, and it gets thrown away every day. It's really easy to do, and we do the training in the office. We show you how to wear the contacts, and then we check you on regular increments. If patients are doing myopia control, we check them more often than yearly to make sure that if there's a change in prescription, we're changing it as quick as we can.
Right. That's really cool. Huh.
Yeah,
That.
you learn something new every day, right?
You know what's funny? After 30 years of glaucoma, like I still can't even explain it to people. Like I don't even know exactly like what. Like I know that there's a buildup of pressure and that needs to be released, and I've had like a bunch of surgeries, trabeculectomies to release the pressure. But I never understand why it continues to build up. And they're just like, I don't know. Like it just happens. Like, do you have any idea? Can you tell me, Dr. Savitz, why glaucoma is glaucoma?
Sure. I mean, that's a loaded question. There's so many different mechanisms of actions that could lead to someone developing glaucoma. And from what you and I had discussed, I think you have a bit of a unique mechanism of action.
Right. Mine was medication, steroids.
Correct. Which that's one way that pressure can build up inside the eyes. But a lot of it is inherited. Our genetics play a large factor. So patients always ask me, is there something they can do, to prevent glaucoma? And unfortunately, sometimes we have, the genetic makeup that's going to cause glaucoma at some point. And the best thing you can do, if you're wondering, is just get your eyes checked regularly, get your pressures checked. Let us take pictures of your optic nerves. That way we can have a good baseline early on, and we can see if there's a trend developing, and either if your pressure is starting to change, if you have changes in medications, like you said, you were taking a steroid, if you have autoimmune conditions that can cause inflammation inside the eyes, that can lead to glaucoma as well. Right. So, like I said before, though, it's a silent thief of vision. There's no symptoms. You don't typically know that your pressure is high, so it's crucial that we are checking for that.
It's fascinating because it's like, it starts with like your peripheral vision, and I don't have much left or barely any, but like I can never tell or understand how people who have it don't realize that they're losing it. Is that because like the brain adapts in some way to like it not being there? Like how do people not notice?
Yeah, because so glaucoma impacts our peripheral vision, not our straight ahead central vision. So it's hard for you to realize how far out you're able to see. Right. You don't really think about it. If you took your fingers and held them all the way out here and here, you could kind of get a sense for how far out you're seeing. Right. But over the course of the progression of glaucoma, that just starts to work its way centrally. And if you are starting to become aware that you've had a problem with your peripheral vision, usually it's doing things like driving or walking up and down steps. It's already too late at that point. It's crazy. And we want to check you and make sure that if you're developing any loss of peripheral vision, we can maintain your case so that it never becomes a functional loss of vision where it affects how you're living day to day.
Right, if you can drive or whatnot. And yeah, it's pretty crazy. I've had friends. So I went to a camp for visually impaired and blind kids when I was younger, run by the state. So I've always been around a ton of kids, and some of my best friends are completely blind and from different things, right? So I have friends with like retina issues, right? And like they couldn't play sports or in case they detached. Right. So there's all these different things. And, like we said in the beginning, you just kind of take it for granted because you don't realize that there's so much, because it is connected to your brain, right? It's just this whole beautiful network just working together. And it's not like, breaking a finger, it's like if something happens with either one of those, it's like your eyes are essentially controlled by your brain, right? And and all the nerves back there. So like head injuries, things like that, like so many things can cause eye issues. And so, definitely something I don't take for granted. I've definitely been on the journey. I've had some surgeries, and which is, it's always like the itchiest thing. You get injured other places and it heals, and nothing itches more than an eyeball post surgery. It's crazy. So, all right, sunglasses. So I want to talk about the sunlight. There's this whole trend now in the health and wellness community. Make sure you get some sunlight in your eyes in the morning, your circadian rhythm. I personally try not to wear sunglasses too much. Obviously, if you need to wear them, like it's important not to, burn your eyeballs out. But is there any truth to it, doctor, about, getting some good sun in the eyes once in a while?
There's nothing wrong with getting good old vitamin D.
There you go.
Kids should be outside for, at least a couple hours a day playing. That helps with the development of our eyes. But really, wearing sunglasses is really important. And we should be wearing sunglasses as often as we can when we're outside. It helps prevent against macular degeneration, like I was saying before, and also everyone develops cataracts.
Right, I have those too.
But it's also that's coming from UV damage. So,
that's the only way it happens. I've never really thought about it, but can they form from anything else, or is it really just the sun?
Cataract formation. Yeah. Well, cataract formation is just kind of part of the normal aging process of the human body. So if we live long enough, one of our rewards is that we are able to get cataract surgery.
There you go.
But if you're not regularly wearing sunglasses, the UV light can accelerate that process. And we will see patients that are from certain parts of the world where they're getting cataract surgery done when they're in their 40s,
really?
Or they've got signs of UV damage on their eyes when they're very young. Another thing to consider too is skin cancer around the outside of your eyelids. It's a very common place
your eyelids?
To get skin cancer.
Really?
Yeah, it's a very common spot.
It's because it's so thin?
And it's always exposed to the sun.
Wow.
So wearing sunglasses is your best protection against skin cancer too.
I had no idea that people get it on their eyelids.
Absolutely.
Something else to add to the list to worry about, right? It never ends. It's like, you're gonna get cancer from this, cancer from that. And now I have to worry about my eyelids, Dr. Savitz. I can't handle it. So we were talking before about how it's really important for you guys to just have like a big stake in the community. How you guys have been there for years and years and years. And so tell me about that, like why that means so much to you guys to just kind of be, the community eye doctor.
Yeah, I mean, I've got 2 little kids that, we live in Scotch Plains now, and we just love helping our community. And this particular practice has been in this area for so long. A lot of people have come to rely on this practice for their eye care. I've been seeing some patients in our practice that have been coming here. This is their only practice that they've ever gone to, and they're my age now. And they started getting their first eye exam here, and I'm their second eye doctor they've ever seen.
Wow.
They may have seen one of the previous owners their whole life, and now I'm taking over. So we really like helping our community, and it's just great to be able to see familiar faces in the area.
Go to farmer's market and you see everyone.
Exactly. Exactly.
So your wife works with you, right, in the office?
She does.
And she helps keep the show on the road?
She does. She does.
It organized.
And she loves seeing familiar faces as well. And she works in the optical space.
Cool.
So she helps helps style people with new glasses.
Very nice.
Helps pick out the selection of our frames.
She seems like she has good style. Like I would trust her to pick out
She
my
absolutely
glasses.
does.
Because you can't tell, right, when you're trying on glasses. It's one of my biggest pet peeves. It stresses me out to get new glasses because I can't see what I look like. You can take a picture of me, but it's not the same as like seeing yourself in the mirror. And
you have to rely on someone else's word, right?
It's very hard. I can't trust that. That's like a commitment. You're wearing these things for like 2 to 3 years, and you gotta be correct. So yeah, sunglasses. People don't understand too. Picking out the glasses, like it's like if mine weren't that special lens, they would be probably like this thick. But it's really amazing, like what people can do now in the contact lenses and everything that's out there. Even, I don't know if you've done any research into like what they do for blind people or like really low vision people to be able to like access technology and see things. Like I forget what it's called, but there's a machine that like reads stuff for you and like tells it to you in your ear.
Oh, absolutely.
It's incredible.
Absolutely. There's actually a retina practice in New Jersey. It's one of the only practices I think in the country that's performing what you actually just mentioned. Right. So there's lots of different technologies, lots of different treatments that are in the pipeline to try to improve everybody's lives.
It blows my mind that we haven't figured out blindness yet. It's been like, I guess it's been a problem this whole time. Maybe we don't spend as much money on it as we should. I don't know, or it's just is it too complicated? Like I said, being in with the brain and having so many things that can go wrong, it's just kind of hard to treat.
Yeah, I mean, once nerves die, once these receptors in the back of our eyes die off, it's hard to regenerate them. So there's lots of research, lots of studies that are being done. I can promise you that that's a major focus right now in the community to try to improve patients' lives with their vision.
Yeah, it's definitely something that, again, people should not take for granted. Get your eyes checked, get your kids' eyes checked. Even our dog has cataracts, and it makes me sad. And you feel bad because I guess I don't do it for dogs.
It's
right?
true. It's true. You can see the cataract in their eyes, right?
Aging, it makes me sad. I had a cataract surgery in 2019. It was really fast and easy. It was not complicated, so it's not something that people should be afraid of. I think maybe some people feel nervous about going back to an eye doctor if they know they kind of, people have that avoidance with doctors sometimes. It's like, just go, call Dr. Savitz.
I tell patients that, you could do cataract surgery in a faster amount of time than I did the exam. Right. I mean, you're in and out.
Literally. And you're in twilight.
The procedure's done in less than 10 minutes. It's really convenient now.
Right.
Within a couple of days, you got your vision back. It's like a once in a lifetime chance to remove a cloudy part of your eye and then correct your vision. So if you've had a really bad prescription your whole life,
it's amazing. Right.
Now you get cataract surgery done and you could see without glasses better than you ever have before.
What's the deal with LASIK? I was never a candidate for it, but I know a lot of people get it. Is that changing lives too?
100%.
Yeah.
And lots of people are still, opting to do that. You have to just be the right candidate, like you mentioned. We'll screen our patients, make sure that there's no risk factors, make sure that if they get the surgery done, they're going to have a good result afterwards. Right. Because it's a permanent thing.
Oh, it is permanent.
Once you get LASIK done,
you only have to do it one time.
You laser your eye, you're not going to do it again, hopefully. So.
hopefully. So what part of the eye do you actually laser with LASIK?
So it's called the cornea.
Okay, it's all the cornea.
The front layer of the eye.
That's all it is?
That's it.
Jeez. See, it sounds simple enough.
So the cornea is reshaped. So the laser will either make the cornea flatter if it's too steep already, or it'll steepen it if it's too flat.
That's fascinating.
And it helps correct your vision.
I had something happen once when I was a little kid where my pupil deflated. Have you ever heard of this?
Your pupil deflated?
Yeah, that's what they told me. I don't know if that's the medical term for it, but that's what they told me when I was little. And then they sent me in for a surgery to inflate it. And then I went in and it did it on its own. And it was like Amanda had a miracle kind of thing. And like all these like nuns from my Catholic school were praying for me. And they were all like, it's because of us, because we prayed for you. And I never understood like what that was. And I was so little, like I never thought about it. But now it's 30 years later and I'm sitting with an eye doctor. So like, is that a thing? Like pupil deflation? Or is that like, is that a term for something else that I
mean, there's lots of things that can impact our pupil, causing it to become acutely dilated, acutely opposite constricted.
I might be making this up, but I feel like that's what the doctor told me. But there's something wrong with my pupil, and they were going to do surgery on it to fix it, and then it just like magically fixed itself. So I don't know. There's part of me that believes that parts like the body wants to not heal, like necessarily heal, but it wants to fight, right? And like give itself like what it needs. And sometimes if we just like you said, get out of its own way. So by wearing sunglasses, you're preventing the damage. If we could do those things for our body or our eyes in general, then cool stuff can happen.
Absolutely, yeah.
Or maybe it was just a miracle. I got to call the nuns and send them a gift basket. I don't know. So, all right, tell everybody your website, where they can find you, how to make an appointment, and once again, all your services, because you said you do eyeglasses and and all that too.
Absolutely. So you can go to our website at www.eyecarecenternj.com, and you can now schedule appointments directly on our website. So that's something new that we implemented this year.
Cool.
We also, you can order your contact lenses from our website as well.
Easy,
So we're trying to make everything more convenient, kind of a one-stop online shop, if you will.
Smart.
And in terms of our services, we do primary care optometry. So, we do ocular disease management, diabetic management. We do refractions for glasses, contact lenses, myopia control, which is what I was telling you about before. We do co-management with surgeons for cataract surgery and LASIK. We have a full service optical. We just revamped our entire inventory this year.
Nice.
So we have a lot of new designers and new brands that are really stylish. If it's eye related, we pretty much do it in our office. Dry eye management is a really big thing now.
Yeah.
So most people on their computers are causing a lot of dryness. Right. So you don't realize that when you're on a device or when you're looking at your computer screen, you only blink 1/3 the amount you normally would.
Really?
So that causes a lot of evaporation on our eyes and dryness. So we like to focus on helping people with that as well.
You know what we should do next time is eye exercises. I don't know if there's a place that you point people to, but I start doing them like looking close, looking far, and then like side to side.
It's called vision therapy.
Yes, people do that because I feel like it will help everybody, especially with all the screen time we have. And the next stuff I can't. That's a whole other episode, right? Of how we need to protect that. But Andrew Savitz, thank you so much. It was very nice getting to pick your brain a little bit.
Yeah,
Hopefully I didn't ask you too many scary questions.
Appreciate it.
But guys, go back to school is coming up. As soon as you get home from vacation, make sure you book an appointment in August before things get too crazy before the school year. But I'm sure you guys are used to it, right? That's just the schedule.
What we do. That's just how
they'll squeeze you in. They'll make it happen. What days are you guys open in the office?
We're here Monday through Friday.
Perfect.
Yep.
All day. Yep. Nice.
Our late days are Monday, Tuesday, and Thursday.
Monday, Tuesday, and Thursday.
Or the late days.
That's pretty good. You get 3 late days.
Yeah.
How many doctors do you have altogether?
We have 2, myself and Dr. Marla Mackey.
Perfect.
She's been in the office for at least 20 years as well.
Wow. So. Holy moly.
Yeah.
That's beautiful. What a great profession to have. Just, your whole life, just being an eye doctor.
Absolutely.
Not too stressful, right? Probably. It's stressful enough, but probably so rewarding that you can do it forever and not ever feel like...
You make these relationships with people, and you get to see, Dr. Mackey's been telling me, and the Dr. Levinson brothers, they know all these families that they're now seeing their grandkids
That's really cool.
from years of seeing the same family. So it's amazing seeing the same people over and over again.
I will say that was probably one of my favorite things about having the restaurant was like when I first opened, people had babies, and then by the time I closed, they were like 6, and you watch people grow up, and there's no better feeling than that.
Absolutely.
For sure. All right. Thanks, Doc. Appreciate you coming on, guys. Go get your eyes checked. Don't take it for granted, and we'll see you next time.